Hi everyone, we have two little guinea pigs that are visiting to deal with a few issues, but I really wanted to do a video to share with you what you may be seeing with your own guinea pigs. Now, these little boys are brothers and they are 6.5 years of age. Now, we've got guinea pigs that are over 10 years of age, but they are like our centenarians, and not all guinea pigs live to have that length of age. And certainly issues start to crop up as they get older. So the first thing I'd like to point out that these two guinea pigs are of two different sizes. So even though they're brothers, they've always been together, the same diet. If we look at them as they are, you can see the fellow on the left is much larger than the fellow on the right. This is indicative of usually some problems that are occurring or underlying their current condition. And we're going to look at those as we check out each boy, and you'll come to know why this fellow is much thinner. Now, for this fellow here, I will say that we're looking at him in a palliative care way, and as we go through the issues, you'll understand more about that. So let's do that now. Hi everyone, I'm Lynn from Cavi Central Guinea Pig Rescue. Okay, so let's take a closer look at this little guy. The first thing is that he has mites and the other boy doesn't. So this little fellow is severely losing fur loss through this section. And what we're going to do is treat this. Let's just turn you around here so the camera can see carefully. But you'll notice all of the hair that's coming out and the fur loss that we have with lots of skin. Now, this is indicative of mites attacking this little guy more so because his immunity is lower. And when we look at his inherent problems, we can come to see why. So just around the front, he actually has a massive lump in around the thyroid, and it's may not be able to show up on camera, but it's actually up here under the thyroid, which is really large, and we need to look into that further. But down below you can also see he has a little tumor which is in here, and again, very difficult to palpate. It's almost a mammary tumor. It is. We'd effectively call it a mammary tumor, but very much a solid lump that extends downwards into near the testes. So this little fellow has some serious issues that are impacting his health, and now we find he's got mites on board. So when we look at the two of them, the reason they are more active on this animal is because of the immunity issues that he's presently confronted with. Let's get that out of the way for a moment. We have actually given him some treatment to stop the parasites, and we're just going to bath off using Malaseb, which is an antifungal, to clear a lot of this loose hair and debris that is resulting from the mites that he has. So we're just going to make this a whole lot more comfortable with him so he feels a lot better. If we get him cleared up, he'll be feeling so much better, which is great. Parasite treatment, when you've got animals that are compromised with other health issues like tumours, like cancers, like other problems, you do need to make sure you stay on top of the parasite preventative measures. Yes, you can see you're enjoying that, aren't you? It's going to feel so much better. Little fellow. Now, with this little guy, he also, I've been told, is getting stuff caught in his front toes. Now, as guinea pigs get older, their little feet and digits curl around more, which means that they are more susceptible to having problems. This comb is really, really useful because it quickly just removes any hair fibers that are about to come out and makes, you can see it just removes a little bit more in the way of hair that was coming out. We can quickly take care of that, which is great. Okay, let's just wet those front paws as well, because the front paws are where, if they're walking on lots of if they're on a manky surface or a damp surface, then fungal spores can be collected there, and they're just more vulnerable. Now this little guy also has some spurs on his front feet, which we're going to deal with. So there's lots of little things we can do to make him feel better. You can see how curly those nails are around. This is just age, indicative of age. Let's wrap you up here for a minute. And we're also going to just quickly do those. These are not bad at all, which is great. Just wiping them clear from any debris that's there. Again, anything to do with mites and fungal, making sure little guy hiding there for a minute. That's it. Making sure they're clear will help. Now another important thing with this little fellow is that he does have a very mild respiratory condition. So we're keeping him very warm. And again, he needs antibiotics, a course of antibiotics to fix this. You'll notice there's quite a bit of residue around those eyes. I'm just going to clear that back so we can see exactly what takes place from this point forward. It's not a well little fellow, are you? Yeah. Well, he's not on his best game. That's okay, we can make him feel so much better. Good. How's that? Get some grass. Can eat that. Right, now, one other issue. This little fellow does have a very wee swelling at the end of his nose. Now, at the moment, there's no, something you can feel, there's no opening for that. So we're going to leave it alone. And my advice is to watch that. Because he's on a course of antibiotics, hopefully that will actually stay on top. I'll just shave that so you can actually see what's going on there as well. And then it's a bit easier to watch. When we get abscesses in this area, they really can become a problem because we have a bony structure in underneath. This is it here. Look at that. Sebaceous. It's actually a sebaceous cyst. Has got a little tiny opening there. Very sweet boy. Let's see what I can do. We're able to, yeah, we can actually move the top off that. So at some point it has had an opening there. What I've done is just remove the contents he would love to remove. Yeah, there's no swelling there now as much. I've just been able to remove that. Wait a minute, let's take a careful look. Just get you like that, much more grass. Just really quick look at that. Make sure we can. It is important with this area, as I said, to really keep this clean. It is a little sebaceous cyst. And it looks a bit. No, I'm sorry, it's in a very awkward spot. There. So with a course of antibiotics, it will really help. Stay on top of that. there we go. Very tricky. You can see what's come out, hopefully all of the contents there. Yeah. Okay, that's so much better. So much better. Good. Okay. Just going to really shade that down so we can keep a close eye on it. Good. And because he's got dark fur in that area, it's very tricky to see, but you saw what was coming out of there. Right, okay, so I'm happy with that. Just get that there. I know, a little bit of a sting. That's very tricky spot. Little guy. Let's just see if we can. Good. Okay, so that is disinfected. I really hope that will stay clear for him. The suspect of it. There's still more coming out. You can see that there. If you don't deal with these properly in this location, they can become a real issue because you've got bone just below there, and the entrance to that is the nasal passage, and of course into the brain, eyes and so forth. So there we go, happy with having dealt with that. Now, your coat is looking so much better, little fellow. Look at your teeth. Okay, nice and straight and white, which is great. Good. And it's got a sizable lump in underneath there. Yeah. Which at the moment, we're observing. Typically when we see guinea pigs with thyroid issues, they do start to lose weight, almost like hyperthyroidism. And in this instance, I think it's actually more of an abscess. It's not attached to the dental area. So we're going to get onto that and get that checked out. Good. Okay. All right. Now, this other little lump, you might be able to see a little bit better now that we've cleaned up. Oh, do you see what is going on? This is more of a cauliflower. Ugh. Okay. Have a look above. Now, how much? Oh, stinky, stinky. How much on earth have you got caught up there? With boys, it's really important to keep them clean. This little guy's got quite a bit of build-up happening there. This is called smegma. We can simply wipe this off. Normally we don't need to do so much with this area because, you know, they naturally clean it themselves, but this little fellow is having a few issues. And he does in fact have a sperm right there. Oh, little guy. Yeah, you can see this is part of the problem. I know it's stuck, isn't it? Oh dear. Okay, all right, we're just gonna ease this out. It's a serious sperm rod that's caught, and it could be causing him all sorts of issues. So we're just going to remove that. Okay. Oh dear. There we go. You can see how much was actually caught in there. Yeah. There we go. That's a bit better. All right, I'm just going to pop him back in the water. To push that back in a bit more. Okay, that is looking so much better and could be also part of his comfort issues, so he's certainly clean down there now. But over here he does have a mammary tumour, which you might get to see it more clearly. See how swollen it is, it extends, it's quite large. So he has some pretty there it is there. So he has some pretty serious issues on board, and that's part of the reason that mites are more active with him. A bit better? Wow, you've been through a little bit, haven't you? So that's it from me. That's it from him. We'll keep you posted, and yeah, he'll be feeling better in no time.